You have admitted that GMC is not affected. That's what I take that answer for that. Is it correct? GMC is not affected because apprehension was GMC because all people can't go now. You have given patients are increasing. So GMC is okay. That is okay. That you will look. Speaker sir, my second supplementary is, Speaker sir, I have seen that the premium paid is almost 52 crores. There are claims, almost 7,346 claims, which must be valuing to around 25-26 crores. But from what I am given to understand that GMC was also part of the scheme. GMC has not raised claims. Why is that? Why is the GMC? Why is that? Do you require somebody else to do it? Or you appoint me, I will sit there and do.
Yes, sir.
Do it properly. Why they are not doing? Tomorrow the insurance company will say, no, let me finish. Tomorrow the insurance company will say that no, it is lapsed. You can't claim now. Why are these claims not going from GMC? Because that was GMC, all hospitals are part of it.
Mane mantra uttar deuni.
Question is now. Uttar this
Challo nahi.
Speaker sir, I agree with honourable member that there are certain deficiencies, certain things have to be done from our department also. So we are on it. Last 2 months we have been seeing, and we have also talked to the Director Health Services to move a fresh file to see what needs to be done. But apart from it, like the member said that already the total premium paid was 52 crores. Total claim received as on 27/2017 was approximately around 38 crores, and total claims paid out is around 26 crores in 31 lakhs and odd. Total number of money paid out to government hospitals is for about 1,128 cases, which is around 7 crores, and private hospitals 19 crores. So that gap is there. So I am working on it. Let me just find out what are the problems that we are facing or what has not been done, if you are saying from GMC, and we will rectify this. But be rest assured that whatever shortfalls are there in this scheme or whatever modification, there are no, that you cannot say shortfall. This is a unique scheme which has been tried out, and Goa is the first state to try it out. And like I said, the Chief Ministers know of most of the whole concept, the whole thing behind it, and so that maximum benefit goes to the people. So we will, like you said, we were going to sit down and going to see what all additional things we can add on into the schemes and ensure that if there is any deficiency or bills are not raised by Goa Medical College, why it's not being done, we will definitely look into it, and I will keep you posted exactly what has happened and what are the reasons.
Speaker sir, my third supplementary. Speaker sir, from the answers, I have got a voluminous answer. I have seen that these cases which have been done, there are many hospitals. There are so many. There are almost with me that all this in Goa, almost 34 hospitals have been, I don't say benefited from this scheme, but they have used their services in giving people of Goa have benefited from this scheme. The burden on GMC was supposed to be less, but the burden is still continuing because patients are still increasing. Speaker sir, 34 hospitals, I will not name of them, Apollo Victor, now Rajgiri, Dr. Gracias, Kampal Clinic, Chodnagar Hospital, all so many hospitals are there. Speaker sir, I only want to ask one thing from the Honourable Minister. Is such hospital, you have said that you will try to increase the number of hospitals by looking into the teething problems of whatever it is. But I want to ask you also, when you are going to do this, whether you will make a mechanism when these other hospitals and this hospital, because I have seen from the last 1 year experience that people go and reach in the evening or night, whatever time, they have the card with them, but they are unable to use it because the people in that particular hospital are not able to communicate to them that this procedure is there or not there. Whether such teams will be there or whether you will make this insurance company some sort of a call center or something where people can call and ask whether your PROs which are doing more work in GMC, whether you are going to make them work on this line, because they are just sitting there. I know PROs are there. Yesterday they had asked in my demand. So I am asking you whether you will make such mechanism where people will be able to call and tell, yes, I have come to this hospital, this card is not using. Because the procedures when I have seen people, I have also given to Honorable CM 2-3 procedures, his person is following up, and procedures which could be done under this card are not being done. So whether you will make a team, when you include in the hospitals, including these hospitals, either from the government side or that particular hospital where patients are truly for DDSY. I have seen KLE hospital in Belgaum who have made a counter there separately for them. If they can do, why can't Goan hospitals do? So whether you will look into this angle, put this part, let whatever costing, they must be costing 2,000-3,000 or 5,000 or 6,000 rupees more. In a month they will have to bear for this cost. So kindly, Speaker sir, I want to an answer from you whether you will look into this angle also.
Because as mentioned to Honourable Member, whatever deficiencies are there, And such deficiencies where you just mentioned that if a person goes with a card to the particular hospital, there is no clarification between the patient and that particular hospital, and he is not made aware whether this facility is available, we can definitely look at having a small call center set up where all these clarification and specifically all these hospitals that are listed, so that to make those hospitals also aware that this thing is available in that particular hospital, so that the patient doesn't have to run from pillar to post with that particular card or not get benefit of the card which he is entitled to get benefit of the card. Definitely I'll look into it. Initially we can start off with having one or two, couple of people put in the health service itself, so that anybody wants to call, we can publicize that number so that this clarification can be given to the particular patient.
Last, I will only request Honorable Minister, I have got a list of 29 cases which were rejected. That is one list, but there must be so many other cases which are rejected, which are not come officially to you. Kindly look into that, and whenever you are making the committee for looking, kindly include me so that I can give my inputs. I have a lot of inputs to give you.
Sir.
Thank you, sir.
I would like to assure the Honourable Member, if he sends me the list of cases, I personally will examine each and every case and explain to you what was the situation. If something has gone wrong from our side, we'll see that we can...
No, not from your side. Include me in that committee so that I will be able to guide you also.
Speaker sir, Nilesh Sagle ulan cover brother. Speaker sir, I would like to ask the Honourable Minister, has already mentioned that the procedures are to be included and which are very common in nature, like the cataract and the transplant of kidneys and then the tubing and the dialysis, which should be given free of cost. So are these going to be listed in the coming time?
Speaker sir, morning itself we were discussing about this cataract. That is covered in a national program. So this cannot be included in a DDSSY because we are doing it free. So money is coming to the state of Goa from Government of India, and that money is going to this DDSSY for, as far as you're talking about cataract, right?
Yeah, cataract operation.
Cataract, we are getting enough money from the Government of India, so we can't include this under DDSSY.
No, but that money is not reaching the...
No, they are doing free.
Oh, they don't know how to go about it.
Because
एक मिनट.
Speaker sir, the department has, what I have got information is, this is what has been told to me today morning. So if I'm still in that process, like I said, to see that first question was cataract, that should also be included under DDSSY. I personally feel that we need to re-examine because the option is there with the person. The whole idea is to give this card is so he has an option to go wherever he wants to get this treatment under DDSSY in the money that is allotted to him. But let me just examine it. And like I've already assured Honourable Member Nilesh Cabral is that whatever deficiencies are there, whatever we can include, whatever we can do to increase the scope, we will do it. And Chief Minister is on the case on this particular DDSSY, how to improve it. And being a unique scheme in the first year always, there will be some sort of a deficiency or there will be some hiccups. We are trying to see how to bring more hospitals. Like I said, the whole idea is to bring in more people. Whatever needs to be done, we will do it. And this also we will examine. Once again, I will examine.
Carlos Almeida.
Speaker sir, I want to ask the Minister, Speaker sir. आमचे वास्को दर्या माने गेलो की मुझे आते he has given the reply saying that 2 hospitals are there. I understand that Sanjeevani hospital is there and Pai hospital, Speaker sir. And I think the procedures are very less. And Speaker sir, आता आमचे patients समोर GMC गेले. थिंगा special beds असतील, Speaker sir, for these card holders. नाला Speaker sir, थिंगा आमचे patient होते त्यांना थिंगा bed असना. कोण बायले patient I think no, they have the bed, Speaker sir. Now, Speaker sir, I want to ask Minister 2 things, Speaker sir. One is regarding Salunkar Medical College, Salunkar Medical Research Center Hospital. Whether it will be covered, if not, then if any medical claim comes from the hospital, they should not be given to them. Ata no समज Salunkar Hospital yes scheme under A na, zala te Salunkar Hospital medical claim scheme एक दिवस cover कर पाहिजे नो. Otherwise, that like facility हो पाहिजे, Speaker sir, आमचे काय करा. आणि Speaker sir, like no GMC जे. ना अनेक Speaker sir, important Speaker sir, आमकां time काय ना Speaker sir, हाने बोलो पा फाले आने सोमवार काबर. आता बे health minister only one time. Like no Speaker sir, like no GMC. आता GMC like patient are separate, they will keep separate like no beds identified for card holders or not. Nala kisata if some patient goes from my constituency, I had gone. Take a bed na. Then I checked up who had the beds. They were patients from other states. When our patients are going there, at least some bed should be should be kept for us.
मंत्र्यांच्या लक्षात आले. मंत्री उत्तर दियात.
Yes, sir. Honorable Member has asked, he has himself mentioned about the 2 hospitals that are covered under DDSSY, that is the Sanjeevani Hospital and the Pai Hospital. Now, these are the two hospitals. SMRC is not covered under DDSSY, but SMRC is covered under the Goa Mediclaim scheme. It is covered under the Goa Mediclaim scheme, and they give credit.
Don't cover it. No, why are covering when they're not taking the coverage under this scheme?
We can't disturb the Goa Mediclaim scheme. Goa Mediclaim scheme is running separately. The DDSSY is running separately on a two different things. So, as far as the Goa Mediclaim is concerned, SMRC is one of the hospitals that is already giving credit to us. And like you mentioned, we can examine the, I will talk to the medical superintendent and the dean and examine the thing about the DDS specific beds could be, but I have to examine. I cannot just make assurance on the floor of the house. But what suggestion you have made, I will definitely discuss it and come back to you.
Okay. So, तारांकित प्रश्न क्रमांक 2, श्री Alexo Reginald Lorenzo.
Speaker, sir, before I raise the question, I would just like to make a mention two things.
No.
One.
You first ask the question only. What do you mention?
I just want to mention, because I should have done it before, but two things I want to.
You mention, you don't mention, you don't disturb the question over times. You mention it afterwards at the 0 hours.
Okay, no problem. Question number 2A.
2A.
Because the answers as per cyclo, sir.
Speaker, sir, this issue has been debated for quite a number of times, and in this session only, regarding kidney failures. Now, I would just like to mention that the minister has given a reply in C that no samples are referred to laboratory. We have come in this house, it has been discussed before, that already two reports have been already there, and they have not concluded. In that reports, there is no conclusion why these kidney cases are happening in Concord. I would like to know why, when you say that two reports are there, you are saying in this answer, there are no samples referred to laboratory to study properties of water.
Speaker, sir, already we had a debate during the demands. Now, you are asked a fresh question whether anything has been sent, nothing has been sent, is the reply that you have got. But already in the past, we have had Honorable Chief Minister also intervened during the debate in the House, that there are two reports already there which are inconclusive. There were two agencies that were appointed to conduct a survey as far as Concord was concerned, and they could not come to a conclusion what is leading to these kidney failures. So if you want me to once again appoint or speak to somebody to take it up, or WHO or somebody like that, we can definitely ask them to take it forward.
No, which is the name of the agency that you have given that?
No, I don't have the name offhand. I can provide it to you. I can get you both the reports and give you the copies if you want.
Okay. Speaker, sir, there are some, I am not a doctor. I have just been given that information. There are 5 stages which come before the final stage of the kidney failure. That is dialysis. Now, I would like to know whether you have any idea how many stages are there, and if before dialysis start, there are 2-3 stages. One second. There are 2-3 stages. So I would like to know whether dialysis, exactly what I want to know is dialysis is being given to patients at the first stage itself. I believe on the first stage you can start treatment medical. Dialysis direct and dialysis is that type. Dialysis is one this we have debated this, and dialysis in scam already debate kala. And I don't want that corporates So I want to know from the minister at what stage they exactly do it, and what is the procedure followed?
मान्य आमदारान प्रश्न जो घातला आणि जो प्रश्न विचारला, हांव हेल्थ मिनिस्टर जाल्यार तरी बी हांव डॉक्टर न्हू, आनी खंयचे स्टेजीर डायलिसीस वयता म्हाका काय कळना तें. आनी जर मान्य आमदाराक जर कितें विचारूंक जाय, स्पेसिफिकली तुमचे नजरेक कितें हाडल्या, खंय तरी स्कॅम व्हडलो जाता म्हणटा तुम्ही नजरेक हाडून दिया. हांव तुमकां अश्युरन्स दिता की तुमकां ताबडतोब पत्र व्यवहाराच्या माध्यमांतल्यान तुमकां सगळे म्हायती हांव दिता. पूण जर तुमी सांगलें म्हाका खंयचे स्टेजीर किडनी डायलिसीस, हांव डॉक्टर न्हू, काय डॉक्टर जावपाची इच्छा ना, हांव हेल्थ मिनिस्टर आहा, डॉक्टर आहा सांबाळपाक, तेंच्या कडल्यान म्हायती घेवन आमदाराक दिता हांव.
सर, I brought it to the notice of the minister. Please inquire, see whether patients are being given, start an inquiry in that manner also. Speaker, sir, one last question. Every year there are only 14 patients. If you go to the records, there are only 14 patients. There are in 12-13 there are 14, 13-14, around 10-11 patients every year, new patients added in Concord. Actually, it's not such a big epidemic if you go to see. And ते काणकोणकार लोक हाशा थिंग इवन डिबेट हाउसान डिबेट जाला की काणकोणकार हाशा मोडगों येता कोण तेंगा काज जायना, नथिंग ऑफ दॅट सॉर्ट. कोण this dialysis हे kidney हा तुगेले failure पड जाता ते only 10-15 patients. Now I want to know from the minister whether all these issues of kidney failures direct, whether you will like see that there is no directly thank Darnai, because there are private people also who are coming. One second. There are private patients also going from Concord must be. We don't know, which is not there in this reply. So I want you to make a proper inquiry whether these patients are given in time, whether they are purposely delivered, everything when you make an inquiry. Second, when you said that 2 reports are there, please see that at least next session we get a proper report of what is happening. That's all.
No, I didn't get you. Just repeat.
Excuse me, Minister.
Next. What report do you want?
No, all these reports, along with, you have said 2 reports are inconclusive.
No, you want me to write to an agency to again conduct a report,
Give a proper report. Why this is happening?
You want me to
identify. परत report दोनदा केले. Second time हांवेन केलो. पयले एपाय inconclusive report आयलो. They are not able to track the reason for it.
Which agency did it? He doesn't know it.
ते हाडून इतलो डिटेल तो जाय जाल्यार.
माननीय मंत्री
अशें कांय ना न्ही ते फाटी केले रिपोर्ट.
Now I have raised the point. की त्यांका dialysis gold time are जाय ते स्टेजी दिनाय. Beginners dialysis जाता.
पयली ताणे हांव आतां त्यापेक्षा फुडली गजाल सांगता because I was also monitoring it. पयली ताणे चेक करचे खरेच disproportionate केसीस आल्या. मुद्दम चेक करच्यो. बाकीचे कडेन आसा. चेक कर.
माननीय आमदार एक मिनिट तुम्ही डायरेक्टली ब्लेम करू शकना डॉक्टरांक तुम्ही डायरेक्टली फर्स्ट स्टेजीचेर डायलिसिस करता म्हणून
notice of the house. I am not blaming anybody.
Don't blame.
I didn't blame anybody. I have
It
said
is the expert who will decide.
The house. Make a proper inquiry.
Yeah, they'll decide.
Yes, sir. I will look into it.
Sir Isidore Fernandez.
Speaker, sir. First of all, regional congratulate करपाचो कित्याक काणकोणकारांचो खूब इंटरेस्ट आसा. Thank you very much.
काणकोणान रावपाक.
We already discussed this issue.
लक्ष सगळे गोंयभर आसता सोडून आपलो मतदारसंघ.
बस.
अरे कोण मात सोयरी बी आसतली स्पीकर सर तेजी कोण थिंगा काणकोण. स्पीकर सर तुवें ते 2 रिपोर्ट सांगले न्हू. Can you show us those reports if you have got? And secondly, regarding that, see now everyone is going for dialysis. एक easy word जाला dialysis म्हणून. Fast recovery, transplantation government कितें help करू शकतलो काय?
Very difficult.
तो डायरेक्ट ट्रान्सप्लांट कर म्हणून लागला.
Because कायदो इतलो strict. I would like to mention to the honourable member that there is a strict law as far as this transplanting of these kidneys and all are concerned. It is not like before where anybody can just donate a kidney and this kidney transplant can happen. And as far as the issue raised by you, I will get whatever information is there in the Director of Health Services and I will provide it to you. I have no issue, even to conduct another report you want, talking to any of these agencies out of Delhi, WHO, whatever, we can ask them to specially conduct. There is no issue.
No, that fright of the people from Kankana, tu koshay kore inquiry kore, send one medical team so that they do the report house to house, waste some money, put in somewhere money.
Speaker, I will look into this.
Yes. निलेश बाब एकाच मिनटाना. चिजिल बाब बसा त्याचे पहिली बटन दामला. तुम्ही एक सभासदांनी लक्षात घेवपाक जाय तुमकां मागीर लक्षात येता आपल्याक प्रश्न विचारपाक जाय तो जेन्ना प्रश्न मांडटा तेन्ना तुमकां विचारपाक जाय जाल्यार बटन दामपाक जाय. चर्चिल बाब प्लीज बसात.
Speaker sir.
प्लीज बसात तुम्ही.
Speaker sir, Honorable Minister said that he will going to place the reports on the house. I will
In
also
short
see,
प्रश्न विचारा.
Short.
तुम्ही खूप लांब उलयता.
Speaker sir, त्यांना dialysis करता. तू दोतोर. Speaker sir, you are a doctor yourself. So you will be able to understand better than him, but you can also answer if you want to answer. No problem. Speaker sir, माझे question इतले विचारता की when dialysis is being given, there are a lot of types of dialysis which you will agree. Correct, Speaker sir? Before the preparation of dialysis, when your government mediclaim is giving dialysis, there are a lot of preparations for dialysis. The injections cost 2,000 rupees, 1,500 rupees, 8,000, which is not covered. Whether you will look into the proper dialysis report, whether your doctors will give you a full analysis of these particular dialysis, this is the cost involved in your mediclaim. It is not getting covered, Speaker sir. You are saying that you are giving mediclaim. You are saying that this dialysis is being given to them, but you are not putting that full package in that. Your injections to be covered are not there. So whether I am requesting Honorable Minister, whether he will take into a holistic view that whatever dialysis is told to be made by the doctors, we ask Mediclaim to sanction. Whether that full package will be considered or yes or no. I just want yes. If
Speaker,
yes,
sir.
how long it will take to do it?
No.
If no, why not?
Honorable Minister, Honorable Member is justified in raising this point. Like I just mentioned, that we are going to sit with Honorable Chief Minister, and if you have anything specific that is left out, now if you are giving 50, I'm just saying, if you are giving say X amount of rupees, that is the package as of now recognized. If Honorable Member has any suggestions, you please...
No, you didn't answer.
No, I understood what you're saying.
I am not a doctor. That doctor there as a speaker will be able
Speaker,
to tell you. Speaker
sir,
मान्य सभासद बसून घेयात. मागीर उलयता.
स्पीकर सर, जर कितें वाड करूंक जाय, हांव निश्चित हेजेर चौकशी करता, कितें आमकां इन्क्रीज करूंक जाय, आनी ते मान्य मुख्यमंत्री कडेन दवरता. आतां जेन्ना रिन्युअल येतलें, तेजे पयलीं कितें मॉडिफिकेशन करूंक जाय करता हांव.
तुका कळलो नाही म्हजे प्रश्न, तोच तू
मान्य मंत्र्याकडे मागीर डिस्कशन्स करूं येता, मागीर करूं येता. म्हाका दिसता तारांकीत प्रश्न क्रमांक 3 श्री क्लदायस.
Speaker sir, I want to ask LAQ number 3.
LAQ number 3.
Speaker sir, answers as per the cyclostyle.
Speaker sir, in Kunkole constituency, the primary health center located in Bali. So I want to ask in this house that there is X-ray machine is working only 3 days, and there is no lift. Still work was not done. So, and I want to ask, there is no generator, only 10 kV, and every time power failure. So what is the reason, Speaker sir?
मान्य सभासद बसून घेयात.
Speaker sir, whatever the honourable member has asked for, I have provided the detailed thing, but if honourable member has just mentioned about certain issues, I will personally come and visit your center, and we'll let us examine it together. And we are starting the process of visiting all the PHCs, CHCs. Already the process is on, director is going every week. Whatever you have any specific issue you have mentioned, you want it to be addressed, we'll jointly inspect and we'll address it. Because problem here it comes in your constituency, Kunkoli, basically Bali and Kepe, in between both those.
Kunkoli constituency.
Yeah, I'm a Bali exciting, Kepe exciting. What we are saying, if you look at the overall norms that are there, so if you go by those norms, then we don't have to again put in another center there. But definitely now things have changed, and we need to look at it in a different way. We'll examine and we'll look at it.
Speaker sir, I want to ask whether in health center in Chandor, Kunkole constituency, any free medicine is given to a patient. I want to know that. The patient.
Now,
any
actually,
free medicine is giving?
Actually, we are supposed to provide medicines there. If there is any instance in front of you where medicines are not being provided at the sub-health center, please bring it to my notice. I will immediately rectify it.
Sir, and my last, this Chandor is known as the historical place and the first capital of Goa. So their sub-center is there already. So I want their 108. Is possible?
Because we are, like I mentioned during the course of the demands, आम्ही ऑलरेडी पयर ठरयल्लें आसा, पयर 10 पयर आयिल्ले मुख्यमंत्रीचे हस्ते आमी तेंचे उद्घाटन केलें, आनी 7 येवपाच्या ह्या म्हयन्यान, आनी तेज्या भायर आनी 7 आनी नवे प्रपोज केल्ले आसा, म्हणजे आमचे कडेन आनी 14 एम्ब्युलन्सीस एडिशनल येवपाच्या, तेज्यान आमी डेफिनेटली कन्सिडर करूं शकता. सद्या उत्तर जें दिलां प्रपोजल ना म्हणून, पण खंय तरी मॉडिफाय करून तुमकां जे रिलीफ ना, तुमकां जे रिलीफ दिवंक जाय, म्हणजे लोकांक जी गरज आहा ते डेफिनेटली तेजेर लक्ष घालून दिवपाचो आमचो प्रयत्न आसतलो.
फिलिप्स नेरी रॉड्रिगीज.
Speaker, there's a question in Chandor, Kunkoli constituency. About the 108 ambulances at Chandor sub-health. Speaker sir, and पहिले उत्तर दिल्ले आसा की this Chandor area is taken care by PHC Bali, PHC Shishini. PHC Shishini comes in my constituency. I have demanded the upgradation of PSC Chichidi. Leaving that aside, Speaker sir, 108, how you are placing the 108 ambulances in a particular area or a constituency?
Because as of now, we have given full independence to 108 to examine where are the accident hotspots, which are the areas need to be covered. We are running short at the moment. We are running little short of ambulances. It is not that it has to be in a particular location itself. They, over the statistics collected over the last so many years, they have got accident hotspots, locations where absolutely we don't have a 108. Those locations need to be covered. Now, in Salsette itself, we have got a couple of ambulances which are there. So we try to see that the response time, in order to reduce the response time for the patient, accordingly, the placement of the ambulance has to be there in that particular thing. If Honorable Member has any suggestion, or if there's any issue, or where the incident where the ambulance has not come to handle the patient, please bring it to our notice. We'll examine and put it. But one thing I want to make a mention is that we have given free independent to the 108 people to place the ambulance based on the statistics and the accident hotspots.
तारांकित प्रश्न क्रमांक 4.
स्पीकर सर, जे बाळ्ळी PSC तो म्हाकाय लागता. जशें क्लेफासान जो क्वेश्चन विचारला पळय, आमी डिमांडाचेर हाचेर उलयल्ले. तुमी हांगा एक्सरे मशिनाचेर तुमी रेग्युलर ह्या ना म्हणटा, पूण आतां हें हाडलो आसा, पूण रेडिओलॉजी थिंग ना. ते परत एक्सरे काडले उपरांत मडगांव धाडचे पडटा. आमी कितें म्हणलें, हांगा फूल फ्लॅश PSC जावची. नवी हॉस्पिटल बांदपाचो पर्पज कितें जाल्लो, तुमच्या टायमाक जाल्लो, अपग्रेड करचें. पयलींची PSC एज इट इज दवरून कांय न्ही, ते अपग्रेड करची म्हणलें आमी. कित्याक थंय वेळ्ळी, केपें आनी कुंकळी अशी लागता. अपग्रेड करपा जाय, हांव म्हणटा गरज आयची.
Speaker sir, Honorable Leader of Opposition is aware that this work was going on for a pretty long time. Now this work is complete. So we have immediately told them that both these centers should be fully functional. And now the load on all this is also going to increase. So what we have decided is we are also shifting the dialysis instead of Kankod. We have one floor which is empty. We are having the dialysis setup put there in the hospital. Whatever additional facilities we can give, we are examining. Actually, I didn't mention it during the demands. बट तुमची जी सेंटर आहा, तुमचे दोन्ही हॉस्पिटल आहा, हांवें ऑलरेडी आमच्या डायरेक्टराक सांगलेलें आसा की हे दोन्ही हॉस्पिटलाचेर आमकां लक्ष घालूंक जाय आनी हे दोन्ही हॉस्पिटल फूल फ्लॅश फंक्शनल करपाचो आमचो प्रयत्न आहा. एक आमी नावेली घालतले. नावेली तेंचे हेल्थ सेंटर आनी डायलिसिसची फॅसिलिटीज आमी ऑलरेडी नोट एंड मूव केल्लो आसा. आमी बेगीन थंय फॅसिलिटी उपलब्ध करतले. तेजे भायर नावेलीचो सेंटर जो आहा ते मॅक्झिमम अपग्रेड करून जे फॅसिलिटी दिवंक जाय थंय आमी दितले. आनी तुमचे दोन्ही सेंटरान तुमकां जर दिसता, विरोधी पक्ष नेत्याक जर दिसता की कितें कमी जास्त जाता, तुमी केन्नाय म्हाजे संपर्क साधा. पूण आमचो ऑब्जेक्टीव हा की टायम खूब जाल्लो आसा. ह्या सरकाराचे कमिटमेंट आहा हेल्थ केअरा खातीर. तुमचे दोन्ही सेंटरां मॅक्झिमम अपग्रेड, मॅक्झिमम फॅसिलिटी उपलब्ध करून म्हणजे लोकांक त्रास जावं नये त्या तरेची फॅसिलिटी दिवपाचो आमचो प्रयत्न आसतो.
तारांकित प्रश्न क्रमांक 4 श्री चर्चिल आल्लेमाव.
Permit me 4B.
OB.
Speaker sir, answers as per the cyclostyle.
Yes sir. Hinga intal dala question minister falsada. Debate hadless ani demands dala and question आज येता. हे falsada कित्याक question full आसपा जाय आनी मागीर डिमांड आसपा जाय. I think problem कितें जाला, पयचे डिमांडाचेर म्हाका
टाइम टेबल प्रत्येक फावटी तसो जाता.
ना स्पीकर सर,
इट इज नॉट पॉसिबल.
ना स्पीकर सर, हिंगा प्रॉब्लेम कितें जाला,
वी आर गोइंग एज पर द रूल.
स्पीकर सर, हांवें चाल हिंगा कितें हिंगा चाललें हांवें बेनावली एट प्रेजेंट बेनावली पंचायतांत हेल्थ सेंटर म्हाका जाय म्हूण आनी तेणें उतर दिलां दित म्हूण. हिंगा आन्सर ना
आतां तेंच्यांनी सांगलें न्ही तुमकां.
ना स्पीकर सर हांव कितें सांगूं सोदतां,
आनीक प्रश्न कितें विचारता
हे हावजांत न्हू आन्सर दिता आसतना सारके कायद्याचे येयले जाल्यार बरें जाता.
इतलो प्रश्न ताजें काम जालें,
हय,
जाल्या बद्दल
तेज्या पयलीं प्रश्न विचारलेलो
बद्दल तो पिरगता.
जालें म्हणून
तेणी धन्यवाद म्हणपाचें.
जालें म्हणून हांव बसता, जालें म्हणून हांव बसता
अशें सांगात. तारांकीत प्रश्न क्रमांक 5 कार्लोस आल्मेदा.
Speaker sir, answers as per the cyclostyle.
विचार.
स्पीकर सर,
एकाच मिनिटान विचार. टाइम फक्त 1 मिनिट.
स्पीकर सर, मिनिस्टरान हे दिलें पोस्ट दिलें, होप दिलें पोस्ट लायक 28 पोस्ट लायक वास्को चिकालीम हॉस्पिटल जातलें म्हणून. एक म्हाका विचारपाक चिकालीम हॉस्पिटल केन्ना ओपन जातलें एंड वॉट टायप ऑफ पोस्ट इज 28 पोस्ट ऑफ वॉट, डॉक्टर, सर्जन, पेडिशियन, लायक वॉट टायप ऑफ पोस्ट?
बसून घे.
Speaker sir, Speaker sir, this project we are coordinating to complete it at the earliest. These 28 posts don't only include Class D or Class C, they include even certain doctors. We need additional doctors to be made available there. Doctors, what we have, will not be sufficient to run this new setup. AMCA, already about 95% work has been completed as per the reply given to you. We are following up with GSIDC to complete the infrastructure and hand it over to us at the earliest.
प्रश्न काळ सोंपलो.